Okay, so welcome to the JUPAS Information Week. I'm Professor William Choi, admissions tutor of the Bachelor of Science in Speech Language Pathology program. And today I'll talk about nurturing future speech language pathologists. So in this talk, basically, I'm going to talk about how our program nurtures our students to become successful speech language pathologists. And most importantly, you need to be a competent speech language pathologist after graduating our program. And most importantly, imagine some 30 years later, old people like us would retire. So we also want to prepare you to become leaders of the field. So down the road, you will someday pick up some leadership roles and to keep advancing our field. So this is what we want to train you to become: competent clinician and also a competent leader. So there are basically 5 ingredients of becoming a successful speech language pathologist. The first one is always having strong communication skills, because SLPs, we focus on 2 things: communication and swallowing. So communication is the major task that we try to achieve in our future. So this is why you need to have strong communication skills. And communication is actually 2 ways. Instead of just expressing yourself, you also need to receive information. So hearing what other people say. And in addition to strong communication skills, you also need to have strong analytical mind. When patients or clients, they say something, you need to analyze everything on spot. Any speech sound error, you need to know, oh, what causes this error? Then you can design any treatment goals for them. And importantly, you also need to have a helping heart. And this is basic for all health professionals. You need to care about people, care about your patients, or even care about their families. For example, we have a lot of disordered populations, such as autistic children, and we also need to take care of or manage the emotion of their parents, because some of them, they may have some issues with that. So having a helping heart. And you also need to enjoy working with people. So SLPs, we work with a lot of different populations: children, SEN, typically developing children, adults, elderly with stroke, with all kinds of different neurological disorders. And that's why we encounter people from different walks of lives. Even when I was an undergraduate student, I encountered a singer. Okay, I cannot tell who he or she is, but we have some voice cases, and most of them, they are either teachers or professional voice users, such as singers. So different walks of life. And at last, as I said already, we need to have good listening and observational skills, because you need to be a patient listener so you can make sense of what your patients say. And in 2022, we talked about these key ingredients. And if you're interested in knowing more, you can scan the QR code and refer to them later. So now let's talk about our curriculum structure. As you know, we're a 5-year program. And in year 1 and 2, we call them foundation program. So in the first 2 years, we would not push you to the clinic to work with patients. We would help you build a theoretical foundation. And before you offer any assessment or treatment to disordered speech, you must first know what typically developing children be like. So the first 2 years basically is to help you build a foundation on typically developing speech. So in your first year, you would first learn about human development, a very broad overview of how children, they progress. First, 2 months, they start to learn these, and then 1 year old, they begin the first word, things like this. And then we have anatomy and physiology for speech and hearing sciences. So basically like biology class, you need to learn muscle names, bone names, how they control your vocal folds. So In addition to that, we have clinical linguistics. For example, now we have some children speaking, and you need to transcribe them into some alphabetical symbols. So how do you do this? And the next one is Introduction to Communication Disorders. So we try to give you a very brief introduction of what different disordered speech you may encounter. This is not a detailed course, but to plant a seed for you to later develop. And that's our year one. So as you progress to year two, we will learn about speech science. So it's kind of like a physics class, acoustics, sound waves, fundamental frequencies, all these. And then we will learn about neurology and neuroscience. So people are thinking, wow, your speech language pathology, what has neuroscience or brain science to do with you? Well, remember one thing, what controls your speech? Your brain. Okay, so this is why we need to learn about brain science or neuroscience. And then you will also learn about evidence-based practice. So this is more like clinically oriented course to tell you, oh, when you're treating your patients, you should rely on existing evidence rather than relying on your experience, okay? Why does it work? Oh, my experience tells me it works. No, okay? The evidence, the empirical evidence, the research says that this approach is good. That's why I'm using it. And we'll learn about research methods and statistics, basically like math class. And usually SLP students, we don't like it because we didn't sign up for math. But yes, we do need this class because as I talk about later, when you reach year 5, you will need to do a research, and research always needs math. Okay. And then we'll talk about, we'll introduce you to clinical practice. So again, we'll not push you to treat patients, but we'll introduce to you what SLPs do in the clinical setting to plant some seeds for your year 3 and 4 clinical practicum. So in year 1 and 2, we have the foundation laid already. So in year 3 and 4, they focus on disordered speech or different kinds of disorders. So in your 3rd year, it would be focusing on pediatric disorders like children, okay? Anything wrong with children. So in the first course, speech and language development and disorders, you'll learn about different speech and language disorders. For example, 巴士講咗做巴子 okay, what kind of disorder is this? 佢而家6歲啦，但係淨係識講單字，唔識講句子。What kind of disorder this is? Okay. And then voice disorders. For example, some people, they might speak with very hoarse voice, 聲沙啦, which could either be singers, keep using their voice, teachers keep using their voice, or simply children keep screaming around, 成日大聲講嘢啦，搞到傷晒聲帶，喉沙啦, okay, voice disorders. And we also talk about audiology and oral rehabilitation, basically deafness or hard of hearing. And then eventually in your semester 2, you will have your first pediatric clinical practicum. So we're pushing you to, treat the patients, assess the patients, but don't be afraid because before we push you to the clinic, we would have pediatric complex cases management. So basically, we will ask you to sit together as a group and we have a hypothetical case, okay? 呢個 case 6歲佢點點點, and then you all group together to discuss the possible assessment and management plans. So this can help you bridge theory and practice before you actually see patients, okay? And after a fruitful year 3, you would be promoted to year 4, and you'll be focusing on adults this time. So you'll learn about many different things like aphasia. Aphasia basically is after elderlies, they have a stroke, they will have problems with their language and speech because of some brain damages. This is why you need to learn in year 2 brain, okay, neuroscience. And you also learn about swallowing disorders. Most people in the interview, they like to say, okay, SLPs, you don't only do speech, you also do swallowing, okay? So swallowing. And we also have fluency and craniofacial disorders, for example, 口吃啦, stuttering. And then we eventually in semester 2, we would push you to the adult clinical practicum. You'll be treating adults this time, stroke people and manage their communication or their swallowing. Again, do not worry. Before we push you to the practicum, we would have complex cases. So again, you will sit together and discuss some possible solutions for different types of disordered populations. And so you can bridge theory and practice. And in your year 5, you now have already learned the foundation, and you also have learned disorders in the children population, in the adult population, but you don't know how to work with different professionals. For example, if you're doing children, you need to work cooperatively with kindergarten teachers, primary school teachers. If you're working at a hospital setting, you need to work cooperatively with doctors and nurses, but you're never taught to do this before. So you have your year 5, which focuses on interprofessional practice. And in addition to that, we also have a core element called research in human development and communication disorders. So research is basically to help you learn how to do science. And at last, we would have an advanced clinical practicum to give you a lot of clinical experience before you graduate. So for the delivery methods, we can see here, we always do lectures and workshops, no matter your year 1 or year 5. But clinically, in your first 2 years, we would still give you some clinical experience. You will not work directly with the patients or clients, but you will observe your seniors' performance in their clinical settings. And then when you're year 3, we start to give you pediatric clinical experience, and year 4, adult clinical experience, and in year 5, again, more clinical experience in different settings, in our internal clinic, in outside schools, in NGOs, nursing homes, and hospitals, which I'll talk about later. So our students usually have very strong theoretical knowledge because we deliver it in a spiral learning mode. So what do we mean by spiral learning? We first teach you the theory, and then we push you to the clinical practicum. In the clinical practicum, you would encounter things which are said in the theory, or it would reflect the findings of a theory. And then, so you will come back to the theory again. So they're not separate. They will be repeated across years, and which could further reinforce what you have learned theoretically. So we call this spiral learning. You're learning like a spiral. It comes back up and back and back again. You learn it, the theory in year 1, in year 3, it will come back. Year 4, it will come back. Year 5, it will come back. And in our clinical practicum, students are required to complete more than 300 hours of direct clinical contact under the supervision of our experienced clinical educator. So don't worry, you will be supervised when you're seeing patients. And you will have this in a variety of settings, which I'll talk about later. And we put a strong emphasis on evidence-based and scientific practice. Whatever you do to your patients, you must have solid evidence from the scientific literature supporting your decisions. So this is an introduction of our internal clinic. Basically, in your 3rd year, in your very first clinical experience, you will have clinical placement in our internal clinic, which is located in Kennedy Town Center. I happen to be the first batch of undergraduate students using this clinic, so you can tell that it's pretty new. And in this clinic, we have 4 clinical rooms with dedicated tools for assessment and intervention for different children cases. Sometimes we also have adult cases, but in year 3, when you are first exposed to clinic, it's all children. And we also, as you progress to year 4 and 5, we will push you outside Hong Kong U. So you would be doing your clinical placements at external sites, such as kindergartens, mainstream or special schools. non-governmental organizations like 協康啊、康智會, okay? And some of them would have placements in nursing homes or old age homes, mostly focusing on swallowing. And we also have hospital placements. We would assign students to different hospitals like Queen Mary Hospital, Prince of Wales Hospital, Queen Elizabeth, everywhere. And they mostly focus on swallowing cases. So in addition to our clinical placements, we also have experiential learning. And experiential learning basically is to help you experience what the real life is like. And we have them embedded in our coursework. And we have some events such as World Voice Day or World Swallowing Day. We would visit external organizations and clinics like some Technology Center. And in the past, we had an experiential learning service trip to Wuhan, long time ago. And I still remember, yes. And in the World Swallowing Day, we would ask students to live their life as a dysphagic patient for one day. So in that one day, we would ask you to, when you drink water, always add thickener. When you eat, you always eat soft diet, okay, 原餐, to help you experience what your future patient will be like. Okay, so this is some of the photos which we took when we organized some visits to Technology Center. And we also have some interprofessional education. We are trying to, in the future, we are trying to combine students from different programs. For example, we're SLP program, we would have a joint class with the early childhood education, which means pre-service kindergarten teachers, to learn about how you can cooperate on managing children's language difficulty. And we also have some collaborations with the Faculty of Medicine on how to manage hospital cases. So we want you to meet together already before you actually enter the industry. And since COVID, everything has gone online, so has SLP. And we did have this telehealth clinic. We can switch online for the speech therapy. So you can see here, the speech therapy is teaching the patient how to pronounce words. And some students, they are very worried. Oh, you asked me to go outside and see patients in my clinical practicum, but I don't feel ready. I'm gonna kill someone maybe. So what can I do? We have this simulation clinic for you. So what do we mean by simulation clinic? We have students from APA, 演藝學院. They would come over and act as real patients. So no matter what you do, you will not kill someone, okay? It's all fake. And as for the students' feedback, they find it quite meaningful, rewarding, inspiring, nervous. Ignore this comment. Okay, so basically they like this a lot because it really helps them psychologically and practically prepare for for the real clinical practicum. And here we also have a room which looks like real hospital settings. And again, we have those APA actor patients to pretend to be patients. And in addition to clinical skills, we do have a strong emphasis on research because we also, in addition to training our students to become clinicians, we also want to train them to be scientists. So in your year 5, final year, everybody has to conduct a research project. And we have different research laboratories, and students are welcome to join the laboratories according to their own interest. And for example, I'm one of those students. Although I was trained as a clinician in my final year, I became super interested in research. That's why after graduation, I started doing a PhD and focus totally on research. So there are many options. Entering this program does not necessarily mean you will become a clinician. You can also become a scientist. Okay, many different options. And for some brighter students, we have this university level research fellowships for you. Basically, the university would give you money to travel abroad. Maybe you'll attach in a lab in Toronto or in London for summer, and then come back with the research findings. And in fact, our students are doing good in terms of research because, as you can see here, they have published many different studies in internationally renowned journals. So we're not only doing well clinically, we're also doing well scientifically. And in more recent years, we also talk about innovations and innovations, technology innovations. So here, one of my students, she designed an app using AI on speech sound screening. So she has won multiple awards from the university and also from external bodies. And this showcased the success of our program in nurturing future entrepreneurs and technological innovations. So now let's talk about the admissions requirements and application procedures. In the coming year, we plan to admit 48 brilliant students. And there's no fixed quota for JUPAS and non-JUPAS applicants. As long as you're good, as long as we think you're good, we would admit you. And you must attend an interview. And for the JUPAS people, the interview is face-to-face in group discussion format. And it will take place around in mid-June and late July. And let me see. Yeah, in this specific year, it would be June 17 and July 31st. So make sure you're not traveling. Okay, June 17, tentatively. All right, so we would only consider applicants who put our program in their Band A choices. So it must be A1, A2, A3. Doesn't matter which order, but it has to be Band A. Yes, and you'll not be required to attend 2 interviews, only 1. So if you attend the mid-June interview already, you don't need to attend the late July one. As for the admission scores, this year we're doing it differently. Before, we were doing best 6 subjects, and now we're only doing best 5. In category A, including M1, M2, and your English needs to have a level 4 or above, and we count all subjects equally. And in the previous years, biology was a required subject, but we no longer need biology. And a lower quartile for best 6, okay, we're doing best 5, but in the previous year, best 6, then it was 36, median 38, upper quartile 39. And this is just to give you a reference. Okay, now interview tips. Again, this year, we're doing a group interview, and we look for students with strong communication skills, strong analytical mind, logical thinking, good listening and observation skills, and ability to work with people. And please do avoid doing these things. First of all, not talking. Sometimes we really have people sit there and not talk, although they want to do speech language pathologist. So please do talk, but do not dominate the discussion. Because in previous years, we also have people who are too keen to talk. They don't let other people talk. We don't want to have these kind of people, okay? So do talk, but don't talk too much, as in dominating the discussion. And please avoid being aggressive or confrontational. Group discussion is a discussion. It's not a debate. You don't need to fight each other, okay? Be diplomatic and polite. And we also have people not following instructions. For example, I'm asking you For example, I'm asking you to give give me a reason why you would be a good speech therapy, and you just recite a whole passage on, oh, my sick grandma and my brother with something. Okay, follow the instruction. We ask you to one question, then you answer that question. Don't prepare a script. Okay, and dismissing other people's opinions. So in the previous years, I encountered a group. They all keep throwing ideas, but they never respond to other people's ideas. So it's basically like five machines. They're separately producing ideas. We don't want this. We want to see interactions between the members of a group. All right. And my last advice for interview is try to be interesting, but safe, of course. Why? Because in the afternoon we have already interviewed like 100 people. We're sleepy, and we already have encountered 70 people saying I have a sick grandma, or my brother has disordered speech. That's why I want to become speech therapist. Try to say something that is genuine, okay, and more that can help you stand out from other people. So, at last, how can you prepare for yourself? Study the information we provide on our program website, and the link is here. And most importantly, follow our IG. So soon you will see a post about some tips on the interviews. So please stay tuned and follow our IG.